to your participant if there's any risk in the research. Yes, so you have told them about risks. You explain to them about risks. Yeah, maybe there's pain during an injection. Any risk you tell them about. You tell them that they can withdraw. You don't have to continue for 2 years. You can withdraw whenever you want, especially if people, your population has got some vulnerable people, like people who have got mental illness or children. Yeah, so you can withdraw at any time. They are not bound to you. Another thing you tell them that has to do with respect for persons is confidentiality. So that the information is not just for sale, okay? Confidentiality. Yeah, and you have seen like recently with the health scheme the government was proposing to give information to the, I don't know, is it to the United States? The first issue people talked about is confidentiality. If you have an organization, maybe like a telephone company, is your information just being given around to anyone to call you at any time? Confidentiality. And what? And data protection. That your data is safe. So these are some of the things that you talk about when you talk about respect for persons. Yeah. So it should be strict. Strictly, the information is for that study. It is not for after you've bought maybe a soap, then I can give your company to another your information to another company that is talking about creams, and you didn't ask that. Yeah. Beneficence. Yeah. What is beneficence? Beneficence means you should maximize benefits in the study. There should be maximum benefits in the study. That means that you should have reduced harm, reduce harm to the participants. So what are some of the benefits that we can talk about in a study? For example, you can say you want to advance knowledge. Okay, you want to advance knowledge. Let me introduce another slide and reduce this. I just want to talk about benefits down here. So some of the benefits that we can talk about are, for example, you want to increase knowledge in some disease. You can advance knowledge. Another benefit you can talk about is you can improve an outcome. In our case, it's a medical course, so improve a health outcome. Provide educational value. Provide educational value. So those are the benefits that you can state, yeah, in your study. When it comes to harm, what can we talk about harm? Harm can be different types of harm. You have physical harm. Yeah. Maybe your study is unsafe. Yeah. They are being injured during the study. Your participants have been injured during your study. That is an example of harm. Harm can also be psychological. What kind of harm can we say is psychological? You are stressing your patient, your participant. you are what can we say? You are embarrassing your patient or your participant. You're causing them psychological harm. Yeah. Perhaps you keep sending them, go for the results yourself, very far. You're embarrassing them, calling their name out in the line cam. The ones who have got gonorrhea, the study has moved to this side, you're causing them embarrassment. That's a type of harm. There can also be social harm. What is social harm? You're causing them to be stigmatized. Yeah? So everyone will know, everyone who is going to that room, because you're busy shouting, are going there because of some disease. They're going there because they have some disease. So yeah, they're being stigmatized. Yeah, they're losing their reputation. Okay, because now you are there announcing. You've even written in the newspaper that you'll be conducting the study in room 4 everyone who has got this embarrassing disease. Even if it's not an embarrassing disease, maybe people don't want their situation to be known that they are suffer from a respiratory condition. Yeah. So social harm. Some people are very sensitive. There can also be economic harm. What do we mean by economic harm? Economic harm means now you tell them and they're desperate. You'll see people are very desperate that anyone who wants the treatment for a specific, let's say for syphilis, they have to come on Monday between 11 and 2. And then they can only be coming during working hours. See now, these people, they were supposed to be at work. Now they're not able to come. So economic harm, you've caused them a loss of salary, a loss of financial loss because they want to be treated. They're so desperate. There's nowhere this disease is being treated. It's being treated for free. Then you decide that they have to come daily, even if something can only be given once a month. You decide, no, let them come daily so that I can observe them. That is called economic harm. You've made things quite impossible for them. So that is what we mean by beneficence. You're supposed to maximize the benefits and minimize the risks to your participants. Now, another core principle of ethics is objectivity. What do you mean by objectivity? We want to reduce subjectivity. You'd like to increase your objectivity, so you want to reduce subjectivity. And what does that mean? It means that you're supposed to ensure that you don't have skewed presuppositions. You've not said like you're very sure that everybody, I gave this example maybe last time, that everybody who has acquired this disease is promiscuous. So you have already begun with that kind of thinking. Then you select your participants based on your thinking. Since you have decided that everybody who has this disease is promiscuous, then you will go to the streets and select all your participants maybe who engage in promiscuous behavior. That way your result will not be objective, because obviously your population has come from people who, yes, they have that issue of being promiscuous. You've not selected your population very well. You're not assigning to, you're not aligning your aims to your study. You've already decided these people, you already have a conclusion even before you've started. So of course your conclusion will be skewed. Yeah. So you should attempt to reduce what we call research bias. You're supposed to reduce research bias. Now, what is research bias? So reduce bias, research bias. Reduce research bias. Now, what is this we're calling research bias? What is research bias? Anyone can From I give you some reading material. Were you able to look at it? Anyone can give us some kind of explanation? So research bias, just to save time, it's when a researcher intentionally or unintentionally screws the research. So research bias is intentional or unintentional. Intentional or unintentional skew of an inquiry. And I've given you the example how you choose a population. So either you know that you are doing it or you don't know. So it is intentional or unintentional. So you influence how you'll arrive at the end result. It skews your outcome. Yeah. So you're not getting your data from everyone who is affected by that issue that you are researching. You're researching. So it causes you to have a problem in your aims and how you sample your population. Yeah. And we're saying it can just be because of poor design. Your poor design. So you are not going to be objective. Now, there are many types of bias. There are many types of research bias. I just want to give you one or two. So if you stop seeing the slides, let me know. I'm just trying to increase them, put information that you can write and refer to later maybe. So we're saying, what is the types of bias? You can have something called a selection bias. And that means that you select your participants and exclude some group, okay? I've given you the example. You've gone, maybe you're doing a study on STIs, and you decide, now let me just go to maybe the pub where they sit this perhaps let's say these night workers. And you decide you're only going to survey that, and you're only going to ask questions on that, and then you're going to come up and you've already decided that no, this disease, you're expecting to find this result in these people. That is a selection bias. So it is because you're surveying, you're excluding other relevant groups because other people can also be suffering from a similar condition. We also have an analysis bias. What do you mean by an analysis bias? You leave out some data points, yeah, to favor your thinking. You leave out some data points. So you decide, so everyone who is negative, you will leave those out and you only include those who are positive. Why? Because you want to favor a particular result. You want your result to say that, no, this new strain is only in these people. So you leave out data points that are important when you're analyzing, yeah, when you're cleaning your data. We also have what we call procedural bias. What is a procedural bias? Procedural bias, like it suggests, it has to do with the procedure. So it occurs in a study when you are collecting data in the wrong procedure. You're using the wrong procedure. For example, when now you're selecting your participants, you only select the ones who you want to give a specific response because you're already looking at a specific outcome. Okay, so how do you do that? You only go out at night. For example, in our example, you decide I'll only go out at night. I'll only go to the places where these people who you are thinking have this maybe gonorrhea. are frequenting. So you go out to the bar at night, only there. And that is the only place in your procedure that you put it. You'll only be going to make this sample between the hours of 9 p.m. and 3 a.m. Yeah. So you've already ruled out that the other people cannot be there at that time. Therefore, who you're getting there is only that population. So, for example, that's an example of procedural bias. So, how do you avoid bias? Here now we're saying you have to try and increase your subjectivity when you are doing your methodology. You have to choose analysis methods that are correct. You have to use procedures that are correct to collect the data to avoid bias. You have to perhaps consult people in the field to not to read your work, to tell you that you have reduced bias as much as possible. Okay, so that you are able to collect data that is objective and that reduces subjectivity, what you're already thinking, and increases objectivity. Okay, so you want to make sure that you align to your research aims. That means your research aims and objectives should be correct from the first time, so that you are able to use your methodology correctly to collect the data, therefore reducing your bias. Okay, so as not to skew your your results. Now the fourth, is it the fourth or the fifth? The fourth core principle is what we call integrity. So what is integrity? You want to produce, let's say, honest work. You want to be honest. You want to be transparent. Yeah. You want to disclose information accurately. You want to avoid plagiarism. That means you're citing your sources. You want to avoid intellectual property conflict. You can't say like you're the one who has now discovered this method of analyzing this blood sample. No, you should honor the patent if it's there. So you want to avoid intellectual property misuse. Yeah. So you state that you have used this method. You have used this technique to analyze your data. You've used this method to collect your blood from the field. You've carried it in this container, etc. And you're disclosing your results accurately. You're not going to say that now that you've decided you don't want people to know this, you're going to lie. Or you're going to stay in your room and fill in the questionnaires yourself. So it has to be honest and transparent work. You have to avoid plagiarism. You don't just go and copy. You use AI, write your paper, and then you succeed, you graduate. Then 10 years down the line, they discover someone just takes an interest in you and they discover you didn't even do the work, because it's possible. There are very many people who, very senior people who, after they have gone for some time in their career, you discover they didn't even do the work. They didn't even go to that college. So the work was not done. Someone else did the paper for you. So to avoid embarrassment in future, keep to your own work. So you want to avoid misuse of intellectual property rights. You want to honor copyrights. Whatever you're using that belongs to someone else, just acknowledge the person in your research. If you want to use research which is unpublished, you can get permission from the owner. Yeah, you can still state that you've collected your sample number from this Mary Otieno who did the work last year. Yeah, because maybe you're continuing with their research. Yeah, so such things. Cite your sources, okay, and cite them well, so that when someone goes to the work, they're able to find out exactly what happened. So that is briefly what it is about, research ethics, okay, briefly. Now, I had given you an assignment last week, was it even if it's not going to be collected, to look at one or two things that happened. Let me see if I can connect one or two. So I hope you did the assignment. You looked at a few papers. So one which I find you should have at the back of your mind always. So this one was a paper. It was written where? I think in Harvard University at the community. And this is it. So did you look at this paper? Did anyone look at this paper? Yes or no? So this is it was a paper by someone called Alan M. Brandt. I'm citing him if I was writing. His topic is racism and research, the case of the Tuskegee study. To this day, this thing is still going on. There's still some survivors left. This paper was published in 2017. And this paper was written in the Harvard, for the Harvard community. So assuming that you looked at it, I can give you an essay question. Discuss how core ethic principles were ignored in the Tuskegee study. Anyone? Or should I go through the whole paper? If you want me to go through the whole paper, just say, so that we don't waste time. Should I go through the whole paper?
No.
So you read it. Did everyone read the paper?
No.
You didn't read it? Can I go through it as fast as I can? Yes or no?
Yes.
Yes. So now this, what happened in the, I hope you can see, I want to scroll down. So make sure you can see the paper and then highlight what you can. You can print this paper. It should influence how you think, in my opinion, for the rest of your life on very many topics, and you will see. So I'm just starting at the top. So there was in 1923, there was this public health department in the US in a place called Alabama. Yeah. So they decided to determine the natural cause of untreated latent syphilis in Black males. So they tested 400 men who had syphilis and 200 men who did not have syphilis. So they had 400 men in the study, and then they had a control, 400 men with syphilis, and had a control of 200 who did not have syphilis. Okay. Then they then decided to follow these 400 men over the years and see what happened. So the first published report of the study appeared in 1936, with subsequent papers issued every 4 to 6 years until 1960. That's very recent. So penicillin was available in 1950 to treat these syphilitic men. And these men did not receive any treatment because the study was going on. They decided, why should we give these people anything? We need to know what's happening. So how did they then break ethics, this public health in Alabama? How did they break the ethics principles? And how does this study determine how poor ethical compliance can make people suffer? So I will go down here. So I'm going to miss many things. I would like you to look at the report on yourself and then see what happens. So they decided to do a brief review of prevailing scientific thought regarding race and heredity in the 20th century. So this shows you how people were thinking about Black people just recently. And if they have stopped, I don't think so. So essentially, primitive people, it was argued, could not be assimilated into a complex white civilization. Scientists speculated that in the struggle of survival, the Negro in America was doomed. Okay, so you see, they have already got this. They're not subjective. You already said you are doomed, particularly prone to disease, vice, and crime. So they could not be helped by education or philanthropy. So already here, the principle of objectivity is already lost. So they argued that these Black people, they were already degenerative. They had a specific type of behavior. So they decided to study this disease in them, already having an idea. So physicians studying the effects of emancipation on health concluded almost universally that freedom had caused the mental, moral, and physical deterioration of the Black population. They substantiated this argument by citing examples in the comparative anatomy of Black and white races. So someone called Dr. W.T. English wrote, "A careful inspection reveals the body of the Negro, a mass of minor defects and imperfections from the crown of the head to the soles of the feet, cranial structures, wide nasal apertures, receding chins, protruding jaws. All type the Negro as the lowest principle in the Darwinian hierarchy." Okay, that is very recently. So interest in racial differences centered on sexual nature of the Blacks. The Negro, doctors explained, possessed excessive sexual desire, which threatened the foundation of the white society. Okay, so you look at the details for yourself. I'm just missing very many things. So just so that I can point out the errors in ethics here. So what did these people do? You read all these things for yourself, please. I just want to show you how did they come up with the experiment. So they got a grant. Someone called Julius Rosewen Fund funded this study. It was a fund to determine the prevalence of syphilis among Black populations and explore the possibility for mass treatment. This fund was in somewhere called Alabama, and in Alabama is where we have the Tuskegee town being located. That's why we call it the Tuskegee study. So they said that in Tuskegee, there was the highest rate of syphilis of the 6 counties surveyed. So another study known as Rosewen study concluded that mass treatment could be successfully implemented among Black rural people. So although this is doubtful that the necessary funds would have been allocated, even in the best economic conditions, after there was an economic collapse in 1929. So 1929, those 1920s, there was an economic breakdown, the Great Depression around there. So it was, however, iconic that the Tuskegee study came to be based on the findings of the Rosewen study that demonstrated the possibility of mass treatment. So already here they're saying there's mass treatment at a time when there's no money. Okay, so there were several doctors who were involved in this study, and they decided to choose their population. Okay, they decided, let us go to this Tuskegee place. So he described it as a ready-made situation. So he wanted to go to that place. Already there was a ready-made population of men who had syphilis. Now I'm just scrolling through to the points that I think can connect the study. So it seems that this body, the USPHS, believed that the experiment may demonstrate that anti-syphilitic treatment was unnecessary. You see, it was unnecessary. Why? This doctor noted, it is expected that the results of this study may have marked bearing on the treatment, or conversely, the non-necessity of treatment of latent syphilis. The immediate source of Cummings' hypothesis, so he had an hypothesis. So already we can see that the definition of hypothesis here, it's a statement that you want to prove. So these people wanted to prove that, it is expected that the result of this study may have a marked bearing on the treatment or conversely, the non-necessity of treatment of latent syphilis. He has stated his hypothesis. And he based his hypothesis. Okay, the immediate source of his hypothesis appears to have been the famous Oslo study of untreated syphilis between 1890 and 1910. So this person had done their reading and decided there was no point of treating latent syphilis. And why? Professor C. Book, who did this study in 1890, 1910, withheld treatment for almost 2,000 patients affected with syphilis. He was convinced that therapies then available, so in 1890, there was only mercury to treat syphilis. So he decided, the 1890 study, that there was no need of treating syphilis because it was of no value. Okay, so the one who did the study later on in Alabama based his hypothesis on this. So later on, after mercury, arsenic therapy became widely available in 1910. After Paul Ehrlich historic discovery of 606, the study was abandoned. Okay, Bock's successor conducted a follow-up of 473 untreated men or patients from 1925 to 1927. He found that 27.9% had undergone a spontaneous cure and now manifested no symptoms of the disease. He estimated that more than 70% of all syphilitic patients went through life without inconvenience from the disease. His study, however, clearly acknowledged the dangers of untreated syphilis in 30%. So the one who's doing the study in Alabama already had this prior information from the 1910s, okay? But he did not follow it up. He had his own hypothesis. So thus, every major textbook of syphilis at the time of the Tuskegee inception strongly advocated treating syphilis even in its latent stage. So I hope you can see the flow. Earlier on, the one in 18-something had said, no, mercury is not working. Later on, they said, okay, arsenic can be used, 70% go through treatment, but 30% go through life without a problem, 30% need to be treated for this disease. And it was in the textbook that just treats the disease even if it is in the latent stages. So this just shows the follow-up of the literature review. But now in Tuskegee, already knowing that it is better to treat the syphilis even whether it is latent or not, they still decided not to treat the syphilis. Okay, so in summary of this other study is by no means intended to suggest that syphilis be allowed to pass untreated. So if a complete cure could not be effected, at least the most devastating effects of the disease could be avoided. Okay, so this just shows you the chain of events before they went to this Tuskegee. So read all that. So then we come down to how they decided it. So they've already done the literature review. They've come up with a hypothesis. So the doctors who devised and detected the syphilis study accepted the mainstream assumption, okay, regarding Blacks and venereal disease. The premise that Blacks, promiscuous and lustful, would not seek or continue treatment shaped the study. A test of untreated syphilis seemed natural because that health body presumed that men would never be treated. The Tuskegee study made that self-fulfilling prophecy. Already, we have seen there is bias. I hope you are seeing what's happening about the core principles. So, how did they select the patients? The basic design of the study called the selection of syphilitic Black males aged between 25 and 60. A thorough physical exam, including X-rays, spinal tap, was done to determine neurosyphilis. They had no intention of providing any treatment for the men. So already here you can see there's no beneficence. Even the arsenic that was available at the time, they had no intention of treating these patients. This USPHS originally scheduled the whole experiment to last 6 months. So remember, this experiment was to last 6 months, and you'll see it lasted years. The task of collecting the sample, however, proved to be more difficult than the body proposed. So the doctor canvassed that largely illiterate, poverty-stricken population of sharecroppers, those are just farmers, and tenant farmers in search of test subjects. So they decided to go to very poor people. Already this population is vulnerable, even in those days. If his circulars requested only men over 25 to attend clinics, none would appear, suspecting he was conducting draft physicals. So whenever he put an advert, they thought they were being called for war, so they didn't come. So he was forced to test large numbers of men and women who did not fit their specifications. So how is he testing these men and women? Using blood, this causing harm. He's forcing them, they're not even aware what's going on. So they use a lot of money to collect their sample, to look for a sample, okay? And saying that they would treat these people who they included in the study. So some guy called Clark wrote to the study guy about the situation. It never once occurred to me that we would have been called upon to treat a large part of the country as a return for privilege of making this study. I'm anxious to keep the expenditures for the treatment down to the lowest possible point because it is an item of expenditure in connection with the studies most difficult to defend despite our knowledge of the need therefore. So they already knew they're wasting, using money. They're not going to treat. They don't want to even use the money. There's a great depression. Yeah. So, and he already knows the outcome of the study. So if we could find 100 to 200 cases, we would not have to do another Wasserman on useless individuals. He didn't want even to spend money to test the other population. So it means even the syphilis study, the syphilis numbers were not that high at the time, okay? But you will see the study even led to more syphilis cases. How come? You will look through in detail what happened. I just want to show you the important parts. So when he chose the study, this body, the USPHS, this health body, did not tell the men they were participants in an experiment. On the contrary, the subjects believed they were being treated for bad blood, a Southern colloquialism for syphilis. So when he actually got men who had syphilis, they thought these patients thought, these participants, that they were being treated. They were not told, there was no informed consent, so there's no respect for persons here. They're not told that, no, you're part of a study, and no, we're not treating you. So these men all along thought they were being treated for syphilis. So of course, in the end, the men were eager for medical care. So the numbers of defaulters, the ones who refused to come, because remember, syphilis in the beginning is a very physical disease. You can see the signs. So the men, even when, after they were recruited, and they thought they are being treated. So the numbers of dropouts were very low because everyone thought they're benefiting from a cure. So to preserve the interests of these men, this doctor gave them mercuric ointment, a non-infective drug, while some of the younger men received adequate neoasphanamin. So first he gave a drug, mercuric treatment, which was already ineffective in the 1910 study, 1920 study, 1890 study. So by this time, people are using arsenical compounds. So first he gave them mercury, which this person, they already knew this thing is not going to work. Then he gave a few the arsenic, just to keep them interested coming. So, and he actually wrote frequently to ask for supplies. He feared the experiment would fail if the men were not offered treatment. So let's lie to the patient that we're about to help them so that they keep coming. Okay, so there's no informed consent, there's no beneficence, there's no respect for person. Okay, there's no integrity, as you can see. So you read the rest of it. Then they discovered that the readiness of the test subjects to participate in the treatment contradicted the notion that blacks would not seek treatment. So they were first of all shocked that people are even coming and they're black. They thought these people, they won't even come. The final procedure of the experiment was a spinal tap. So they actually even did very painful experiments on them to get the sample. And even in this pain, complications develop because a spinal tap, as you can imagine, if you go to the ward, it's quite a painful experience for a patient, yet they're not treating them. Okay, so he announced the spinal tap to the patients. And he said, some time ago, you were given a thorough examination. Since that time, we hope you have gotten a great deal of treatment for bad blood. You will now be given your last chance to get a second examination. So they repeated even the spinal tap on this population. So again, you read, I generally don't go through this paper just because it's online. I don't want you to miss anything important. So despite the fact that the assumptions regarding prevalence of Black attitude to treatment had proven wrong, this USPH decided in the summer of 1933 to continue the study. Remember, this study was to last 6 months. Many years on, it's still going on. They have been shown that these Black people want to be treated. They were very sure Black people would not be treated, but then they still continue with the study. They still continue with very painful tests and fake medications. So once again, it only seemed natural to pursue the research since the sample already existed. With a depressed economy, the cost of treatment appeared prohibitive, although it was not, there was no indication it was ever considered. Okay, so then they're just interested in their research. Yeah, I want to be called doctor, I want to graduate, I want to do, I don't know, professorship. So let me continue lying to the patient. Yeah? So a guy said, a doctor, as I see it, we have no further interest in these patients until they die. Okay, this is all in, and you can see, as we're reading this paper here, until they die, number 51 is what we're calling a citation. Okay, so if you go to this article in number 51, you will get the citation where this information was gotten. This is known as a citation. This person has not plagiarized work. So the physicians engaged in the experiments, believing that autopsies could give significant information on the study, whatever study they are doing on syphilis. So let us continue, let them die. We need this research. And then he warned them. One of the doctors warned the other doctor that the men must not realize that they will be autopsied. So all along you're alive, but I'm not going to tell them that you're going to be autopsied. So yeah, I'm not having any hope you're going to live. So it is not my intention to let it be generally known that the main objective of the present activity is to bring the men to necropsy. Can you imagine? You see? So read it in detail. I just need to show you a few things. Then the body offered several inducements to maintain contact and to procure the continued cooperation of the men. So they cheated them. Like I tell you, participate in my study, then I'll be giving you enough money for food. I already know you're very poor, so every day I'll give you shopping. Obviously, you'll keep coming. So what else did they do to cheat this population? They hired a Black nurse, someone called Eunice Rivers, was hired to secure approval for the autopsies. You see, so first of all, they're not even, maybe they're not be educated, they're believing they're being treated, and we're just lying to them, just sign here. It's not when you die, pick your blood and your samples. She gave the men non-effective medicines and aspirin, as well as transportation and hot meals on the day of their examination. Yeah. And then obviously she's Black, so you're thinking this person is speaking my language, is looking like me, so this thing is going well. More important, this nurse provided continuity to the project over the entire 40-year period. The study was to last 6 months, 40 years it lasted. So by supplying medicines, this USPH was able to continue deceiving the participants who believed they were receiving medication from the doctors. When the test subjects complained about the spinal tap, I've told you spinal tap is quite painful. They were just encouraged. Yeah, they were just told, it's helping. It's helping. Okay. So they were just told, you'll read in detail, but they were told this thing is helping. Just continue. And they explained, the doctor wants to make a special examination to find out how you've been feeling and whether the treatment has improved your health. And they know very well there's no treatment going on. First, they're giving the mercury, which is ineffective. Even the arsenicol, which was maybe thought to work at that time, is not only to be given to a few of them, and it's not for the purpose of them surviving. It's because you want to examine them at death. Then finally, it proved difficult to persuade the men to come to hospital when they became severely ill. And so the government, or whoever this body is, said, now we'll pay for your burial. Yeah, how much? $50 per man. That was in 1935. So this was a strong inducement, as funeral rites were very important in that community. Okay, so you see, you continue lying to them, providing them physical harm, psychological harm. Okay, you offer them money to be buried. And then they knew the ravages of untreated syphilis in 1936, and they're still continuing with the study. Now, 10 years later, a report noted coldly the fact that nearly twice as large a population of the syphilitic individuals as the control. Remember, there was a control who didn't have 200 who didn't have the disease, and 400 who had the disease. So twice the number of those who had the disease had died. Was very striking. Obviously, the treatment is not working, but you're still continuing. They have shown that this disease had reduced the life expectancy by 20%, but they still continued with the treatment. So in 1955, it was found that slightly more than 30% of the group autopsied had died directly from advanced syphilitic lesions of either the heart or the CNS system. So they already saw the effects of syphilis in the in the body, but they still continued. Review, then someone says, review of those still living reveal that an appreciable number have late complications of syphilis, okay, and that they will proceed to death. But then the study still continued. So during the 40 years of the experiment, the USPHS had sought several occasions to ensure the subjects did not receive treatment from other sources. So I make sure that I cannot treat you at JKUAT, but I still make sure you cannot reach Thika Hospital. I make sure still you cannot treat Thika Hospital because I don't want my study to be interfered. So I tell you, don't even go. In fact, come for this food and I'll pay for your funeral. So to this end, this guy was doing the study. He met with a group of Black doctors in 1934 to seek their cooperation in not treating the men. So I go to the hospital and tell them, don't treat these patients when they come. Yeah, even if they seek care in the hospitals, don't treat them. The USPSH warned the Alabama Health Department not to treat the subjects when they took a mobile unit into Tuskegee in the late 40s. In 1941, the Army drafted several subjects and told them to begin anti-syphilitic treatment immediately. So by 1941, there was treatment. When you join the Army, you are advised to treat this condition, okay? Because now they need you to go and fight in the war. But many of the men, despite these efforts, by late 1950, many of the men had secured some treatment of their own. So if you're lucky, maybe you meet your cousin who is in Eldoret and tells you, this disease can be treated. You come to this hospital in Eldoret, and maybe these are doctors are not reached Eldoret. So you are managed to be treated. I hope you can see the chain of events. By 1952, almost 30% of test subjects had received some penicillin. So already the treatment for syphilis, and even to this day is still penicillin, was already out, but they did not know. Yeah. So some men who knew someone in another hospital were able to be treated. Others still continued there. If you were not leaving this environment in Juja, you're not aware the treatment is available in Mombasa. So you're just there suffering, spreading the disease. Then the doctor says, the one who's conducting the study, this is Von Delha, he wrote to one of the participating physicians and said, I hope the availability of antibiotics has not interfered too much with this project. A report published in 1955 considered whether the treatment that some men had obtained had defeated the study. The article attempted to explain the relatively low exposure of penicillin in an age of antibiotics, suggesting a reason. The stoicism of these men as a group, they still regard hospitals and medicines with suspicion and prefer an occasional dose of time-honored herbs to modern drugs. The authors failed to note that the men believed they were already under the care of government doctors, and they were not able to they were not able to seek treatment elsewhere. So because they thought they're still being treated, there's some population that didn't go for help. It is only you maybe who traveled outside, who knew that, and your relative takes you, or the doctor there tells you, oh, there's a treatment. So race issue was briefly mentioned in the study. A group of physicians met again in 1969. Yeah, the CDC, at the CDC in 1969, just the other day, they simply did not like spinal taps. A few of those who were tapped were enthusiastic about the results, but to most, the suggestion caused violent shaking of the head. Others claimed they were robbed of their proactive powers. Letters to the subjects announcing an impending USPCH visit to Tuskegee explained, the doctor wants to make a special examination to find out how you've been feeling, whether treatment has improved. So you look at this and you will see, even after treatment was made available, these people in the CDC, they did not terminate the study, even after the CDC decided not to terminate the study, even after penicillin was available. The doctors argued that the study should be stopped and the men treated. The consequence was to continue, and then they said, you will not have another study like this. Take advantage of it. Okay, so there's something called the Hugh report. You can read this Hugh report yourself. Okay, so I've read a bit of it because usually I tell students to read, they don't read, and I never usually do online classes. So first, the Hugh report actually justified the study, yeah, in 1932. Second, they said that penicillin should have been given when it became available. So from 1930 to 1950 is when the report is saying you should have given these men syphilis. And don't forget, these men are also living in a population. So the population is still breeding, they're still transmitting the syphilis. So even the death rates may be even higher than we know, okay? So the final focus of the final report, informed consent, also served to observe that historical facts of the experiment in light of the deceptions, the exploitations, which the experiment penetrated. It is an understatement to declare, as the report did, that the experiment was ethically unjustified because it failed to obtain informed consent from the subjects. Okay, so read the conclusion of the study. It was a horrific study. And I think I think when Bush was the president, he tried to apologize. But too little, too late. So in retrospect, the Tuskegee study revealed more about the pathology of racism than it did the pathology of syphilis. So it shows you what the racism was more prevalent than the syphilis, the results of it. It talked more about the nature of scientific inquiry than the nature of the disease. They were more interested in the process than treating the disease, okay? So you read it in detail so that it can not become disjointed. So here are this person's references. Let us look at reference number 51 that I pointed out of just interest. So reference number 51, if I go to this person, Wegner to von Dalha, which was one of the studies published in 1933, if I look for this statement, I will be able to see that this person is one who said that statement. If I go to reference number 75, it's a minute of some unpublished typescript. Okay, this is called referencing. Okay, so at the end here, so it is It is now known that syphilis is rarely infectious after an early phase. At the time of the study's inception of latent syphilis was thought to be communicable. The fact that members of the control group were placed in a test group when they became syphilitic proved that at least some infectious men were denied treatment. So some of the controls who didn't have syphilis, they still got the disease, and they were moved to the syphilitic group. So this shows that they were even denied treatment. So when subjects are drawn from minority groups, especially those with which the researcher cannot identify, basic human rights must be compromised. These men were all white, the doctors. They already had a view about Black people. So it says here, if you cannot relate to your patient, how can you even help them? So look at this in detail, okay? Please look at it, read it, and then you're able to identify core principles that have, ethics principles that have been ignored. Now, so that we don't think this is an issue only with, do we have any questions? Any questions? We assume there are no questions. I just want to now show you another large study, or if there are studies, where we get these codes we're talking about, the Nuremberg Code and these other WHO codes. So what happened in Germany? Use the wrong one, but let's see if we can summarize for us. So in Germany also there were similar issues. Okay, what did they do? Let's see if they've summarized. Okay, during the war, the Second World War, the First World War was 1913 to what, 1918, 19. The Second World War was about 1939 to 1945. So in the Second World War, the Germans took the Jews and decided to do ethnic cleansing. But in those places where they were doing ethnic cleansing, they decided to do tests. We look for a better article than this. They decided to do tests on them to determine very many things. I'll look for something else. To see how people can survive in cold temperatures, to see how they can survive, how long they can last without food, etc. To conduct experiments on the human population. Again, ethics was avoided. Okay, ethics was avoided. So this article, you look at it, I was just trying to show you some examples of compromise of the 4 principles of ethics and how the Nuremberg Code became a fact. Now, also in this study, like here, I don't know if you can see this sentence. So here, just as public outrage over the Tuskegee study strongly influenced the development of the original federal regulations on human subjects in the early 1970s, the widely publicized generation of the story of Henrietta Lacks in 2010 influenced the attempt to treat biospecimens as people. So in this paper here, there's a lady who was called Henrietta Lacks. She was a Black woman who developed a cancer, and they took her cells because her cells were not dying. She had very unique cells that were not dying, and they used those Lacks cells to for research, okay, without her consent. And it was just even last year that the family, the Lacks family, were demanding acknowledgement of the use of their relatives' cells, because the Lacks cells then went ahead to make very many medications, okay? Henrietta Lacks. So please look at that story as well. So that is also an issue of ethics being ignored. So They then had these regulations known as the Nuremberg Code. So those of you who watch movies, there's a movie, I think released last year or this year on Netflix on Nuremberg. Have a look at it. The trials were done in a town called Nuremberg in Germany. And Nuremberg focused on potential lethal experiments, some that ended with death, risk of limb and life, torture. And that it was an inquiry in Germany done by, they were called the Allies, the Allied countries. I don't know, Russia at that time, Britain, America, France, to prove that whatever the Germans did in the experiments was against human ethics. Okay, then they came up with something known as the Nuremberg Code. The Nuremberg Code. So you read this article, which I'll send you if I've not sent you, and it shows very many ways in which over the years ethics has been violated, and that's how they come up with things like the Nuremberg Code, the Belmont Report, where they actually have hearings and say that now this is how we should conduct research. Okay. Are we together?
Yes.
So I can give so many examples of, let us see, ethics that have been ignored, including in children's, let me see if I can get some more. Children's hospitals, you decide they're going to experiment on only this population. Okay, so you'll go, can you see my screen when I'm searching?
Yes.
Right. Okay, so you will search. And I tell you, when you do a search, whatever topic you're searching about, you don't just go to any site that has come here. Although they may give you information, but you cannot cite this kind of information. Let's narrow the search. So if you just try and narrow your search, you use a lot of words, you keep narrowing. We cannot look at Wikipedia. You can look at it, yes, but you cannot quote it. We can look at the second one here. It is cited by 91 people, 91 authors. It's from the National Library of Medicine. So there's a big debate. Even after these experiments were done, were they beneficial? You look at it. Of course, they were beneficial because there are so many results that came up about it. And that's what I want to show you. And so in 2017, we marked 70 years of this Nuremberg Code. So this Nuremberg, I've told you, it's a town in Germany where the Allies decided to prosecute the remaining Nazi high guard, the high command of Nazi, to try and prosecute them for whatever they had done. So here, this abstract, you can see, here's an abstract. The abstract talks about the Nuremberg Code. It summarizes the informed consent provisions of this research in the Nuremberg Code. So the Nuremberg Code introduced informed consent. These people have to know what it is they're being done and why. So the Nuremberg Code set the standards for every subsequent attempt to regulate experimentation. In the first principle, 70 years later, it's most important the requirement of voluntary, competent, informed understanding. You can't just go to a child below 18. That is why in your ethics you'll say your study subjects are above 18 years old. You cannot, if you're going to use below 18, you have to seek consent from the legal guardian, okay? Because then this person, are they competent to make a decision, okay? That is what the Nuremberg talks about, the Nuremberg Code. So informed consent. You can read all these things. Then the Belmont report, you look at it, again, it came about from talking about all the ethical things that went wrong in the study. So let us look at types of experiments that were done. I would not look at AI, but I know them, so I'll just tell you, we're looking at this one. They froze the subjects to see what will happen when they freeze them. They took them to decompression chambers to simulate high altitude to see if they could survive. They injected them with some substances to see if they could sterilize them. Yeah, they call it the final solution. They did the twins experiment. This Dr. Mengele is very famous. He did horrific experiments on twins. Okay, all this information, you can see it's quoted in books, the results. But what people went through for it was not acceptable. They didn't treat wounds. They contaminated them with bacteria, with malaria, and all sorts of things to see what will happen. They removed their bones and nerves without any anesthesia to do and study what would happen if they will die. These people really suffered. You can watch several movies, and that's how you have the Nuremberg Code being established. Then Lux cells. So this was a black woman. The HeLa cells, HeLa, H-E Henrietta Lux cells, she had immortal cells. I told you her cells were very unique. When they took a tumor from her, the doctors at that time, of course she was also black, the hospitals were for white people. So they realized that her cells did not die, they divided rapidly, and they could use them in the lab. And her cells, to this day, they're still being used. They're immortal cells. They use them for scientific experimentation. They use them in virus, cancer, vaccines, so many things, the Lux cells. So I was telling you, was it last year, 2023, I saw her family on the TV. They have not received any compensation. This lady has not, or her family, and her cells have been used to make so many medications, so many medical benefits to this day, and they're still not acknowledging this black woman. So here are the Lux cells that I used to date. They did not inform her. They did not treat, they just took her cells and then continued with, without her knowledge, without consent. Okay, so look at these articles. So I hope that, are you able to see? I think you're not able to see. Are you able to see my slides when I move? Or my screen when I move? I tend to think not. Yes or no? Like now I'm on the Lux cells. Can you see my Lux cells?
No.
And you're not saying, let me see, can I stop sharing? Can I share something else? Share. So if you stop seeing, as I talk, I'm actually talking on a specific. Are you able to see my slides moving, my screen moving? On this lady called Henrietta Lux? Yes or no?
Yes.
Okay, now, so I just opened her, so you see the Lux cells. Here, this lady, they harvested her cells. They have used her cells for so many medical conditions, and to this, they're called the HeLa line or the HeLa cell line, and to do vaccines, polio vaccines. They've based cancer vaccines on her cells. And at a time when the cells were taken, they did not acknowledge she died of the cancer. She was buried in an unmarked grave, and her family to this day are looking for compensation. So you will watch some of these videos on your free time, because I cannot tell whether or not you're able to see my screen when I'm on the other side. You watch this. So this behind are what we're calling the purple green ones are the lac cells. How long is this thing? You go and watch this thing. Okay. They're immortal cell lines with a lot of medical benefits, and yet no one to acknowledge. So and there's so many I can give you over the years. Experiments that human ethics has been ignored. I don't know, so many in schools. Which one do I know? Apart from the Nazi one, the Tuskegee is very important also. Can you see my screen?
No.
Okay. Let me connect again. 1 second. So I want to give another example of the Willowbrook study. Again, I don't encourage you to go to AI. I'm just doing it because of time and because I already know the facts, wherever they are. There was this other one known as the Willowbrook study, where they took these children who had intellectual disability and decided to test the effects of infections on them. So what they did, they took children with mental retardation who lived in that hospital, someplace in New York, and they infected them with the hepatitis virus. Okay. Once they infected them with hepatitis virus, they then they were fed actually stool from infected people's stool, and they gave them the purified version. Then they decided to check the effects of hepatitis on these children. Then when they investigated the study, they decided to defend their study by saying that majority of them would have gotten the infection anyway. They would have gotten the infection anyway. So the disease was left untreated in these children, this hepatitis, as these people continued to study. Okay, so there are very many cases. So this one was in New York, somewhere in New York. Yeah, you can look at it. It was a crowded place for children. First of all, they cannot make informed consent. So there's so many experiments, and even in the recent studies, I've seen quite a number of places where you can see ethics has been ignored because the population is cannot make a decision. For example, do you remember in Kenya when was it like 2 or 3 years ago, people came and they had the eyeballs being pictured? Do you remember that? Do you remember that eyeball business? Do you people ever check the news? Or you're just okay? So maybe when you're one of the people whose eyeball was taken and you were given, was it 5,000 or was it 10,000 shillings that was being given at the time so that you can participate? Just the other day, it was a very big thing. And to this day, nobody knows why the people are lining up in KICC to have the eyeballs taken. Those people, the pictures of their retinas being taken. To this day, they just knew there was 5,000. So just to show you how people are naive and easy to cheat, 5,000 was offered. KCC was full. Nobody knows what's going on. Okay, let me give you a more, can you give me a more recent example here in Kenya on the medical side? Anyone? Anyone can give me an example of where medical ethics has been neglected? Anyone? So I want to give you this example. It's been in the press lately. Have you seen this one? You will watch this video. It's a 12-minute video. Can you see my screen? Yes or no?
Yes.
So did you see this? Yes or no in the recently? Again, I don't advise you look at the eye overview, but since I know the facts, I can use this example. The men were interviewed. That's why I'm saying watch this video. In 2025, there was a video in July. In August 2025, can you see there was another video? Can you go and check this? And here, there was a town, yeah, where Westerners buy human organs for 2,000 pounds. It was in somewhere in Rift Valley. Then Kenya halted kidney transplants after the Dashawela DW. That was in April 2025. Now, why is this one important according to you from the information we've talked about? Is this a medical issue or not? Can I have an opinion? I don't want to put the video. I want you to watch the video yourself. They are not one video. There are several videos. This is a recent thing. Can I have any opinion from the 40-something people who claim to be attending this class? Or another example where you feel that human ethics has been, yes, this was not a study, but it might as well have been a study. We don't know what has happened to these people's organs. Can I have an opinion? Or were you one of those people who were offered a boda boda? So the CAT is next week at 7:30 in the morning, class rep. Because it appears I've been speaking to myself. So I have to do the CAT next week because there's no point of continuing. Does anyone have an opinion on this topic? Any opinion?
I think I have an opinion.
Yes, please. It's very important at university level, you're able to give an opinion. It doesn't matter whether it's right or wrong, and I cannot say it is right or wrong because it is your opinion and it is not an exam. And it is only by having an opinion that you are able to go to wherever you're coming from and assist your population. Because I'm telling you, even these examples are giving a very minimum. There are very many in your, you'll be shocked when you go home. You'll find whatever is going on, you'll be very shocked. There's so many people are not aware. So give me your opinion, please.
I think it was unethical, the organ harvesting, because it was not carried out, to maybe sort out a medical emergency or something. Plus the fact that these people were selling out their kidneys at a very cheaper price. And I think the people who are harvesting were going to sell it at a higher price.
Yes, that is correct. Because the Kenyan law yes, it does not allow, it has only that you can donate to your relative. It doesn't allow that you can come to an entire village or community. And because these men were so many, that's why I'm telling you, watch these videos, you'll be shocked. These videos were, these men were so many that you find that there was one specific video, just to watch. They are, I don't know if I put it, to take my time. They are being escorted to the hospital by the mothers. They were not told the effects of this organ. They are now sickly. Yeah, the men are now sickly. They were not told the effects. You've been given a border. Some were even promised. I think they didn't receive, or the money they were given, they did not receive. Just watch. Can you see this video? Let me put it.
Pardon?
Let me put the video since.
As rich patients from Germany, Israel, and beyond pay huge sums for life-saving transplants. Our next report is by DW Nairobi Bureau Chief Mario Müller, who was part of the investigation team.
This is Amon Kipruto Meli, 22 years old, from a village in western Kenya. Like many young Kenyans, he struggled to find steady income, jumping from one job to the next. One day, a friend told Amon about a quick and easy way to earn a lot of money. Amon was promised $6,000 for his kidney.
They didn't explain anything to me. They pointed at people around us and they said, "Look, they donated and they're okay. They're even back at work."
After surgery at a hospital in Eldoret and only a few days of recovery, Amon was paid only $4,000, less than agreed. A short time later, Amon began feeling unwell and fainted. His mother rushed him to the hospital, where she was shocked to learn her son was missing a kidney. After finding out he had sold it, she reported the incident to the police. Amon is not the only young Kenyan to fall victim to organ-selling schemes. We discovered one of the companies organizing kidney transplants is called Medlead. It appears Germany is one of its target countries, among others. The demand for organs is high in Germany, where there are not enough donors each year. Sabine Fischer-Kugler turned to Medlead for a kidney transplant and admits she paid a six-figure amount. She says she doesn't regret her decision.
It might have been selfish of me, but I wanted the kidney. The contract terms were in order, but it's clear to me that it's not quite right.
Kenya's health ministry commissioned a fact-finding mission to one of the hospitals where kidney transplants have been conducted after allegations of organ trafficking taking place there. The inspectors found transplants were conducted despite poor matching results and in high-risk cases like cancer patients. But their report calling for an official investigation never seems to have been acted upon, a source familiar with the matter told DW. The investigator working on organ trafficking cases in Eldoret says he has encountered difficulties.
I feel it is because there are external forces. Being organized crime, there are very powerful people who may be involved. So they can use many ways of blocking.
Medlead states it has a success rate of 98%, while the company regrets that organ rejection can occur in individual cases. It denies any wrongdoing. All donors are said to be 100% altruistic, and Medlead writes it has been operating transparently and in full compliance with the law since its foundation. Researchers say organ traffickers are able to prey on vulnerable, poor people thanks to legal loopholes.
There's a legal gray area that this syndicate is exploiting. So because there's no law that prevents you from actually donating your kidney for money, and you cannot be prosecuted for that.
In Amon's case, his mother never heard back from the police after reporting what happened to her son, she says. Amon is now unable to do many jobs requiring physical labor.
If I could go back in time, I would not have said yes to anything. I would not have let them remove my kidney. Even if they tried to persuade me, I would not agree, because right now I'm desperate.
Amon says he feels like he's been taken advantage of.
Now, DW has reached out to the Kenyan Health Ministry for comment, but we've not.
So, you go and watch these videos. There are quite a number on this topic. So let me ask you, in your opinion, what's the difference? And remember, the patients who are receiving these kidneys are in Germany, where the so-called Nuremberg Code was written. So even though there is no law in Kenya prohibiting that, does it mean that prohibiting you from donating your kidney, but this, you are not informed on the long-term consequences? You're already poor, so you are vulnerable. You're being given money. Some people, even if you saw them, were being given borders. This article came, I think, last year several times, and there are very many articles on in the press. Just have a look for yourself. So what is the difference between what is happening to these people and what happened many years ago in all those other examples we have given? Is there any? Can you see any correlation?
Yes, there is. There is a correlation, Doc, because
Yes.
personally, I've followed this case issues in Kenya, and even to the moment you realize that no steps has been done. Though there are now there's a legal system going on in terms of generating legal framework, but when you're not giving someone enough information in terms of the consequences that will happen, then you are infringing on the ethical standards or the rights of the individual. But we see this also very common in African continent, which is not fair, in my opinion, and it's not right.
Yeah, it is very important to have an opinion. Because even after the Nuremberg Code, people, they are still falling, victim to whatever is happening. I don't know if you remember the one for retina that was happening, retina photography. There was a scandal. What did you call that scandal? I forget. Where they come and picture your eyeball and they got 5,000 shillings.
So it was WorldCoin.
Yes. What is that now? No one knows. People are just lining up. And the people who are lining up, and it was called WorldCoin Kenya. So again, here, it was in March, as of March 2026, WorldCoin remains suspended in Kenya. So what did they do? They pictured eyeballs of people. They offered them. It was 7,000. They had incentivized consent. Now, this was in Nairobi, the middle of Nairobi. Can you imagine in the village? If I go there and I decide I will test my medication there, or I need something from these people. So the incentivized content of 7,000, because of poverty, people took the 7,000. They took biometric data from all these people who are in the middle of Nairobi. And it's significant because the middle of Nairobi, I'm assuming, I make an assumption that you are educated, that, you are slightly better off than in the village in terms of information. Still, the lines were there. And even when it stopped, people are very disappointed they did not get the 7,000. Nobody knows what was happening to this day, where they were scanning these people's eyes. They used a device called the orb. The project was seen as a way to access free cryptocurrency on high demand. How do we know it's for cryptocurrency? We don't even know what was going on. So you are able to see this thing, it goes on to date, regardless of all these so-called rules and regulations. Now, there are also what we call animal ethics. If you have a comment, please make. That's what I was saying. There's no more point of coming from university and when you go home, you're not able to offer an opinion, an informed opinion, an educated opinion on any topic. Yeah, because can you imagine if that is your village and the numbers? If you watch some of this one I watched, at least one or two I watched, they were saying the numbers in that village where that guy is from. There were quite a number of people who lost their kidneys. So what are the long-term effects? Yeah. This man, for example, he's young. One of the women who claims to have received one from Kenya, she's elderly. So what is the quality of life that is left for this person afterwards? Yeah.
Even though the recent one, the Russia scandal.
Yes. What is this? What's going on?
Yeah, you see, people have been taken to from Kenya, from these villages, they are taken to Russia. They are put in front line. They don't even have good skills, and they are killed. You know.
Yeah. So
and you have seen what Russia has said. Russia have said they are not part of the contracts. So Africans, I don't know. I think poverty is not good.
Is it even poverty? Because what happened to, like I always look when I was growing up and I look at some of you these days, or many of you, and I don't know if it is poverty or it is also a level of greed. People don't have a pride in, okay, maybe you can make a decision, you're hungry, you need to earn that money urgently, but there's that, like this pride. Long ago, you couldn't even, the things you could, if you were seen doing, it was just you couldn't be seen doing, because I don't know if the traditional culture was so strong or what. Now you people, you're offered money, even on other social things that have to do with let's not even say experiments or anything. You're just told, let me give you 10,000, you can come and this person is not even poor, and you can become, some prostitute or some, something. There is not, and this person agrees, even comes on radio, comes on TV, is being interviewed, they're even defending their decision, and they're encouraging others to continue with it, that it has really helped them. So I don't know. There is, yes, an issue of poverty, but morals are also lacking, because even for an entire village, for me to tell you that, hey, come, let us, I've been given a transplant, even you come. Yeah, is it that I want you also to suffer the way I'm suffering? Would it need to be prudent for me to tell you, this thing I'm suffering, don't go? I don't know. Okay, so now we have animal ethics. I'll give you a paper, but in general, what I need to communicate about animal ethics is you have to use ethics the same way you're dealing with people. There's some ethics that is involved dealing with animals, and we have the 4 R's. It used to be the 3 R's in some books, but we have the 4 R's. Now, the 4 R's, what it means is that the first R is replacement. That means if you don't have to use an animal, you can use in vitro cultures. You can use bacteria, viral in vitro cultures. You don't have to go and infect the animal to observe how it's going to die and suffer. We have reduction. Suppose you're going to use, you want to use 100 animals. If you're going to, you must use an animal model. You can use less animals, like 3. There's a way of determining it using animal ethics core principles. You use 3 in acute studies. You can increase them as the studies improve. So per treatment group, for example, you can use 3 and have 3 controls, something like that. You don't have to use 300 animals. So you minimize the number of animals to minimize the number of suffering, and you'll still get valid results. So in that methodology, if you decide to use animals, you will have to say, why did you use 3 animals? And of course, you go back to ethical rules and say you've used this method for conducting acute studies, something like that. You will check with time if you don't do animal studies, just to alert you. There's refinement. Refinement means you're avoiding pain and suffering in an animal. Yeah. So you don't have to be there poking the animal. Then you poke the wrong place, then you go for lunch, you come back, you poke again, you keep poking. You have to use a procedure that again is a scientific procedure. You're going to give your medicine through gastric lavage. You're going to inject the animal intramuscularly. So you are aware what intramuscular is. You know what gastric. You don't just go poking the animal. So you're trying to reduce pain and discomfort. Then we have the last R to be added within the last few years has been responsibility. You should have ethical responsibility when you're conducting the research with the highest responsibility. So in animals, we have the 3 R's, now 4 R's. And this is what will guide how you will use your animal model to get a valid scientific result or give a valid scientific information. So we do have guidelines, yeah, and those are the guidelines. For example, and they keep reviewing them every year. Even for the human study, the guidelines you will quote if you're going to use. At your level, maybe you won't use so much of the guidelines, but you will quote that you have done, maybe, depending on your study, I don't know how deep you will go. You've followed ethical principles. You've selected your patients, you've given informed consent, you have minimized pain, suffering, you have sought approval from the hospital board or whatever it is you're going, so that you're not conducting illegal experiments. So I want to show you this example. I hope you can see my screen. Where is it? Are you able to see my screen on this? No, you're not.
No.
Oh. So, where is it? Share screen. Share. So, before we proceed, let's see. So here, where is it? I hope you can see the screen. Maybe this one.
Yes.
Yeah, again, the AI overview, but I don't advise you use AI overview on anything at all. You go to the main source. For example, you can see ethical consideration regarding human experimentation. This person, Kiani, was cited by 388 authors. So let us open this article. This is the kind of person you would quote and see. The number of authors here are at least over 10. And they talk, the summary. What is a summary? Our summary is what we are calling our executive summary, okay? And this is what you would read in a hurry to see if the study helps you, if you want to quote this study, for example. And here they tell us that animal experimentation is widely used, yes, we know, for animals, for humans, treatment options. There are several animal species. So there's rats and mice and purpose-bred animals. Like here, purpose-bred, we would have things like these mammals, like monkeys are used. So, but over 90% are usually rats and mice. However, growing awareness of the sentience of animals and the experience of pain and suffering has led to a strong opposition of animal research among many scientists and the general public. In addition, the usefulness of extrapolating animal data to human studies has been questioned. This has led to ethical committees' adoption of the 4 R's. I've told you: reduction, you reduce number of animals; refinement. So reduction, you can use another method, not animals, do in vitro. Refinement, you're using rules that do not cause pain and suffering to the animals. Methods, replacement, you don't have to use so many animals. Responsibility, you're thinking about what you are doing. You're not just taking animal, throwing, picking, killing. So it's a guide of how you are going to do your animal study. So some of the essential considerations for human animal experimentations are presented in this review, with a requirement for investigator training. Due to ethical issues surrounding the use of animal experimentation, the use is declining. in those research areas where alternative in vitro or in silico methods are available. So this is called an executive summary. Yeah, and this is after the study has been done. There's even one as you do before you do the study. This actually is what you write last after you do it. So here you have the keywords I've talked here: bioethics, 4 principles, animal welfare. You can look at this article for animal research. Okay. You know, how are they living? What are they eating? How are you cleaning the house? Are you reducing pain and suffering? And you're able to come up with results that can be used. Even these days when you're buying a cream or a lotion, you see, they say this product has not been tested on any animal. For the purposes, you don't want to be the one who is making everything in this world suffer for no apparent reason. Okay, so I wanted to just show you here where one of the publications, where is it? And again, here, every institution has its own guidelines, although, of course, their rules remain the same. So you will quote, which one do I want to show? I want to show this Institute of Animal Care and Using in Studies. Are you able to see this document by IACCU, Institute of Animal Care and Use Committee? Can you see that? Yeah, I think you can. I don't know. So, suppose you are to do an animal study, even in masters or whatever. You will have SOPs saying how your animals will be treated, how they'll be eating. You've had someone, if you don't know how to use that method, you have someone who knows how to give the medication, how you're treating the animal, etc. So you can go to some of these big sites if you're going to do it and look at the protocols and then quote the protocol that you're going to use. For example, if I want to do acute studies, acute what? Drug testing. Let's say it's drug testing. It will give you guidelines that you have to read, and then they tell you this is the protocol and you follow this protocol. Okay. So here we've got one for 2016. This author has cited several things, and then you're able to do your citation. I use this method. I've selected this kind of animal. Why? I'm using this kind of sawdust. I'm using this kind of water. My animals are being fed daily. They're being cleaned for. So you document everything to minimize the risk in the subjects, to make sure that there's a benefit, you see, whether it is animal or human, to make sure there is equitable selection, that it is fair, to give informed consent that is legally authorized by the hospital, the participant, and it is documented. Yeah, documented. I just don't come to the class until now I have come. It's not a cat, that you have come to give you the cat. You say, you answer. No, you come and say, this is the study, these are the risks, this is the time period, these are the benefits. Do you agree? You can leave at any time. Your information is confidential. If this population is vulnerable, you have to have a guardian. Okay? Are we together?
Yes.
Now, the cat is still next week. Because, why not? So I'll send you an article on the studies. There are very many studies on field ethics. Even now, you still see people conducting tests. For example, if there is a cure already for TB, yeah, and I conduct a study and I decide that I'm going to be giving a new regimen. So I have two populations, my study group and my control group, and I am not giving the medication to treat. So the disease is progressing, yeah? You failed ethics, and you find some studies are still going. So recent ethical breakdowns. A recent ethical breakdown in medical studies. I've seen, like I saw one in South African medical studies. Then it was on the line for quite a while, and then they removed it. I think they realized the mistake. So here, this study, let me see this one in the abstract. Increasing number of ethical products and services are being offered on direct to consumer. To date, usually when they realize that there's ethical compromise, when you're about to think you can I think they take down the study. Very recent, I can tell you so many. Okay, not so many. I've seen maybe 2 or 3, and you wonder if there's a cure, why are you conducting the test? So in this abstract here, what are they saying? Despite relatively high expenditure on healthcare in Saudi Arabia, its ethical systems remain highly centralized in the main cities, with its primary focus on secondary and tertiary healthcare rather than primary. This has led to numerous ethical challenges for healthcare providers. The article reports the results of a study conducted with a panel of practitioners and non-clinicians in Saudi Arabia to identify top 10 ethical challenges. So, which are the top? This person has given the materials, methods, the results. So there were 10 ethical issues here in this. What they identified was patient rights, equity of resources, confidentiality, conflict of interest. Like, for example, conflict of interest is also very important. I forgot to tell you. If I have the cure, my company has I'm the one who is providing the drug. So my drug to cure your malaria is the main drug. Then I'm conducting it with another drug that from another company or one that is possibly a placebo. I must declare conflict of interest. If I'm being sponsored by a company, I must declare conflict of interest, because obviously the company does not want me to say that the malaria drug is not working. Also, if the drug is mine, I cannot say the malaria drug is not working. If the drug belongs to the institution, there's no one who wants to say the drug is not working. So you have to declare conflict of interest. If the funding is coming from an organization that will provide that saying negative things about them will not be good, you have to declare conflict of interest. Yeah. So ethics of privatization, informed consent, dealing with opposite sex, beginning and end of life, healthcare team ethics. So these were the issues in these papers of theirs. So conflict of, you must declare, if JKUAT funds your study, you say that there's a conflict of interest in your study, and usually you put it at the end here. Like this person says, footnote, sources of support, nil. He did not get any money from any hospital in that country. Conflict of interest, nil. But if you had gotten some money, you have to say you've gotten funding from this. Ama your drug is the one that is being used. Because then your results are skewed. There is bias. Are we together?
Yes,
Yeah.
excuse me, madam.
Yes.
We have another class.
Okay. So the cut is next week. Yes. At 7:30.
Can we have it the week after next week instead?
Why?
So that we can prepare extensively for the cut.
Yeah, so I'll bring an extensive cut and it will be the only cut. Yes. So then I'll give only one more other assignment where I said I will not mark the ones who didn't bring out of 10 because I cannot penalize the ones who brought. Okay, I cannot penalize the ones who brought there as the first assignment.
Excuse me.
Yes.
For those who did, you said you'll give them another assignment.
Yeah, the ones who missed.
Yes.
Yeah, everyone will do the first assignment. Everyone will do the second assignment and the first assignment. But people who brought the first assignment cannot be marked on the same level of those who did not bring. Of course, I'll have to subtract some marks. Otherwise, then what is the point of these other people bringing the assignment early? Do you see? Just before we hang out, let me tell you, there's someone here who has said he wants to do in vitro comparative efficacy of Solanum incanum, that is Sodom apple, fruit, and leaf extracts against Trichophyton tonsurus isolates from school-going children in Kenya. Okay, so just this one, you see, he wants to do in vitro studies against Trichophyton tonsurus isolates from school-going children in Kenya. This is one of your colleagues. So this one, in vitro. What is the understanding of in vitro? Is it in life or not life?
Not live.
Yeah. So he's going to take, he's going to take this. This is now an example why he's not going to use an animal study. So he's going to use maybe we're assuming some bacteria, some virus, some other biolife that is not easily done, that is not alive, really not alive, that is not an animal study. He's going to, I don't know what he's going to isolate. Maybe he's going to collect blood from children. I'm not sure. He's going to do isolates from school-going children in Kenya. So already here, this kind of study, some of the studies are very good, even the ones we did last, but some of these studies, remember, feasibility. Can you do it within the time provided? Can you do it with the resources you have? Time provided, ethical board involved. Money provided, are you going to go now to school children? So I'm not saying these topics are bad. I'm saying feasibility. So I had said I'll be saying one or two studies just to show you what I mean. So how this person is going to do this study, the question is it feasible for them within the time available? Are they going to be able to study ethically school-going children in Kenya? I need to go to the mother or father or whoever is guardian and say, I've come to collect what? Blood sample. To say what? To take to the lab. I'll poke your child. I'll take, So the mother has to understand, whoever, to consent with the study. So again, a very good study. Is it for you? Is it feasible for your level? You determine the result after that. Because in the end, you are the main. Me, I never say, if I'm supervising someone, I never tell you can't do it. Because I always tell you are the primary investigator. But these are my views. Okay, these are my views. So have a good day. So the cut is going to be next week, but 1.
Yes.
Okay. So I hope you are taking note of what I am saying. Because if you don't, your life is going to be hard for nothing. So have a good day.